and a good day or a good evening to all of you who have logged in from across the globe. GeoParcy team takes great pleasure to welcome you for yet another Sunday special and wish a very happy Mother's Day to all the mothers who have logged in. Today's event will really help you because we moms need a nice, strong spine to discipline our children and a strong brain to multitask in today's scenario. So before I invite the guest speaker today, I'll just give you a very short review of what GeoParcy is all about and what we have been doing. Most of you may be aware about GeoParcy, so I won't go into too much detail, but our website and Facebook is there. I'll give the details about that too, and you can take all the details about it. Right now, I'll just share the work that we are doing and the success we have achieved. Yeah, GeoParcy is a scheme that the Government of India has started. A big thank you to Government of India for all the support it extends to the Parsi community. Yes, and along with that, I would just like to share the good news that 313 babies have been added to the Parsi community through, of course, the medical component of GeoParcy. That is, we give 8 lakhs for IVF and fertility treatments, including delivery that is achieved when once the lady conceives through IVF or any kind of fertility treatment. Along with that, we also support couples with 4,000 per month who need assistance for childcare as well as for elderly support. There are a lot of logistics that are there. I won't go too much into detail about that. But of course, health of the community is really our biggest concern just now. And that's why we've started the Sunday special where we will have healthcare professionals and doctors from different fields who will be addressing our viewers and sharing tips on maintaining good mental as well as physical health. Today, we have a renowned neurosurgeon from our very own Dadar Parsi colony, Mumbai. Dr. Mazda Turel completed his MBBS from Grant Medical College and Sir JJ Group of Hospitals, Mumbai. He went on to complete his MCH degree with a gold medal in neurosurgery from the prestigious Christian Medical College, Vellore. He has over 100 publications in esteemed scientific journals and textbooks. He is currently a practicing neurosurgeon at the prestigious Wokhad Hospitals, Mumbai. He also is a scout of Homavazir's 11th CBDS Scout Group, and above and over all his achievements, he is a wonderful and positive human being. A very eloquent speaker, a wonderful writer. He's a columnist in Jame Jamshed. And it gives me great pleasure to welcome Dr. Mazda Turel. Over to you, Doctor.
Hi, thank you, everybody. Thank you for such a warm introduction. It gives me immense pleasure to take part in this program, especially, I think increasing the Parsi population is the need of the hour. We probably lost quite a few Parsis in COVID as well. And what more than GeoParcy trying to increase our population? I'm guessing, even if we've lost about 200 Parsis, we've lost close to half the population. So GeoParcy needs to buck up a little bit and start having close to 100 babies annually. And happy Mother's Day to all the beautiful mothers, including my own, including the mother of my children. I came up to do my talk at my mother's house, and first thing, before even saying hi, she says, "Look how badly you're dressed." So this is to all the mothers. May you always remain unfiltered with your children, and may you be able to speak your heart. I shared this with a couple of my friends, saying that I'm going to give a talk on brain and spine health, especially brain health. So a Gujarati friend replied saying, times are really bad that Parsis have started talking about brain health. It's pretty ironic that this situation. But I believe that the only way to remain sane is to drive other people crazy. So we are going to briefly cover a little bit about brain and spine health. And we are back in a situation where the whole world is shut down in some sense. And that's why I thank all of you for taking the time off to be present on a Sunday morning. I'm, to be honest, really not sure what else would you be doing. But thanks a ton for taking out your valuable time. Every day feels like a Sunday to most people. But I'm going to talk about the brain and all its magnificence. And it's a beautiful, beautiful organ. You can, it's just like a 3-pound mass of jelly that you can hold in the palm of your hand, and it can contemplate the vastness of interstellar space. It can contemplate itself, contemplating. We are able to choose every single day how we wish to lead our lives, and that's the beauty and in some sense magnanimity of the brain. We have about 100 billion neurons in the brain. I mean, I really don't know how they've come to that conclusion. It's just probably impossible to count that kind of stuff. But it's so beautiful that imagine the brain weighs about 1.5 kilos, and you can't feel that weight on your body. And that's because the brain is floating in a bowl of CSF, in a bowl of cerebrospinal fluid that allows you to give buoyancy to the brain. It's only about 2 to 3% of your weight, but it actually uses 25 to 30% of your body's energy. So imagine the stuff going on. They say that the amount of electricity generated in the human brain is more than what all the cell phones in the world at any given time can generate. So let's talk a little bit about some neurological symptoms that some of us have had at some point of time in our lives. And I'm trying to just give you a brief overview of what you should not ignore and what you can let pass by. With this pandemic, there's so much of anxiety. There are mental health issues. People are getting depressed. A lot of people come to me with lots and lots of headaches. So which kind of headache do you really need to worry about, and which kind of headache can you ignore? 90% of headaches you can ignore. That's the good thing. They're either migraine or they could be treated with medication. But it's this 5 to 10% of headaches that you must not ignore, because ignoring those can be catastrophic. A lot of headaches that we see we're seeing nowadays in the pandemic. A lot of people are dehydrated. That can cause headaches. People drink either too much coffee or suddenly stop drinking coffee. Either they bump their head somewhere, they don't know about it. Heart diseases can also cause headache. Sleep apnea can also cause headache. So a lot of those things one needs to be careful about. Remaining hydrated is a good option. But if you have a sudden onset severe headache, a headache that you've never had in your life, a headache that's absolutely unbearable, then that is something you must not ignore. The first thing you should do is get a scan done, because more often than not, it's a rupture of an aneurysm in the brain. Even if you're fully okay, even if you're walking, talking, you could have had a rupture if that headache is intense. In medical parlance, it's called a thunderclap headache. So that's something that should not be ignored. You should get a scan done. If the scan is fine, then that's okay. There are several other conditions that can also cause this kind of headache. But the take-home message is that if you have a severe sudden onset headache, you must not ignore. This is just a pictorial representation of various kinds of headaches. And the last one's my favorite. But now in the lockdown, probably this has been replaced by the excessive number of webinars that people are forced to listen to. But I hope you don't regret listening to this one by the end of it. The other thing is that, you have headaches for about 2 to 3 weeks. You don't know what to do. You ask family, you ask friends, they give you all sorts of advice. It's the exact same thing like COVID, right? Everybody is an expert at treating COVID. So similarly for headaches. So the important thing, if children have headaches, the most important thing to rule out is a refractory error. Get their eyes checked. If they're sitting too close to the television, if they're constantly on their screens, all of those things can give them headaches. Simple things like sinusitis can cause headaches, ear infections, jaw diseases. All those, the brain per se, the brain itself does not feel any pain. So there's no problem inside the brain that can give you a headache. It's only the structures around, the covering of the brain, the blood vessels within the brain, the bone, the soft tissue. Those are pain generating structures. So those are the ones that can cause headaches. So you all have to rule out all these things. And the simple thing to do is just go to a physician. I mean, one thing to do is try paracetamol for a couple of days. You can try something called as naproxen for a couple of days. And in 90% of people, this settles down in 2 to 3 days. If it's stress, anxiety, even if it's muscular headache, none of this. If it's persisting and if it's diagnosed to be migraine, then migraine needs very specific therapy. You can't just take ad hoc medication for migraine. For migraine, you need to take prophylactic therapy and you need to take abortive therapy. So you need to take long-term therapy for at least a month, even if you don't have headache. So that again, to diagnose one's headache as migraine requires a little detailed evaluation. So don't ignore it because there is a cure. Now, if you have headaches for about 2 to 3 weeks and it's not getting better, you need to rule out something inside the head. Headaches that wake you up in the middle of the night is a big red flag. If you wake up with a headache, please don't ever ignore it. If you have even a little bit of vomiting, a little bit of double vision, sometimes you may have only persistent vomiting. I remember having a child who just had persistent vomiting and underwent extensive gastritis workup and colonoscopy, endoscopy, all of those things, treatment for amoebic dysentery and all of those, but just vomiting. And when we did a scan of the head, you found a tumor in the area that's compressing the vomiting center of the head. So it's very important that some of these things, obviously if you have a neurological deficit like weakness of a hand or leg, like a sudden like sensory dysfunction, you'll get an MRI done. But these other subtle things, because remember one thing, that all brain tumors, they don't present with raised pressure inside the head. They don't present with headache, vomiting. They don't present with a neurological deficit. uh, Sometimes they just present incidentally. They'll just present with a mild headache. Sometimes they'll present with some kind of forgetfulness. Sometimes you do a scan for something else entirely and you find a brain tumor. And now again, it depends on which of those will you eventually treat, because some of them are benign and you can leave them alone. But you don't want to miss something that can take away years from your life. See, this gentleman just had headaches and on and off just complained of headache. And you can see, I mean, it doesn't require a rocket scientist. Even my 4-year-old daughter will be able to tell you that there's a big huge mass lying in the brain, and no vomiting, no double vision, none of those things. Very subtly, if you look at his left hand, you can see if you keep it up for a bit, it tends to drop. And that's a subtle indicator that the right side of the brain is getting compressed. On an MRI, we usually switch sides. So what you see, this blob is on the right side and it's causing some weakness on the left side of his body. You realize that your left hand is going down, or you don't? Yeah. So these are things, I mean, we take these patients to the operating room, hook them up to various electrodes, monitor various functions, and we can remove these tumors safely without any neurological deficit. You can see that this guy has his tumor completely removed and did very well. In fact, the weaker hand has become better than his normal hand. And we can even now operate on patients awake. Patients who have tumors in areas of the brain that are eloquent, areas of the brain that are responsible for movement of hand and leg function, and you don't want to risk damaging any of these. You can take these patients to the operating room, operate on them awake, check their hand function while you're removing these tumors from these areas of the brain, so that if you tend to damage something, you can tend to stop and not cause any further damage. You'll get real-time feedback and you can excise these tumors safely. All of this while a patient is watching his surgery on a screen in front of him. And I mean, it's something that we do routinely. But it's one of the great advances of neuroscience. Sometimes things that were thought inoperable are now removed very, very safely. The other thing why I want to bring this to you is, tumors in the pituitary area, in the pituitary gland, can not only present with headache, but they can present with various other things, infertility being one of them. And since we are on a fertility platform right here, um, I've seen at least 3 patients in my life who've been treated extensively for infertility, and they've tried a lot of medication, hormonal tablets, injections, and no one scanned their brain. And we found a pituitary tumor sitting right on the gland that's responsible for secreting all these hormones. And we removed the tumor, and the next day they conceived. I mean, not next day, but you get the gist of what I'm saying. The beauty is, some of these tumors now we can remove from the nose. We don't even have to open up the head. Once upon a time, we required to open up the head to remove these tumors. So now these tumors are very, very safely, very, very elegantly. You can see the beautiful optic nerve over here. You can see this is the pituitary stalk. And this is what gets compressed and does not allow the hormones to flow in the way it's supposed to get to the respective glands. And we can remove these tumors in a simple 2-hour operation. And patients, look at the beautiful anatomy of the brain inside. Patients can go home the next day, or 2 days, 3 days after surgery in a straightforward operation. But just because I'm saying it's simple, don't try it at home if you have time on a Sunday, okay? The other really, really important message that I want to give to you is, don't label anybody as being forgetful or as having some kind of dementia or some kind of behavioral problems unless you scan the head. We have a lot of people in the pandemic who are behaving badly. It's because of depression, because of anxiety. But my suggestion is, don't start anybody on antipsychotics unless you scan the head, because you can have tumors in the frontal lobe. And those can cause these symptoms. Those can cause exactly symptoms of forgetfulness, behavioral problems, anxiety, depression, because the frontal lobe is responsible for planning, execution, feelings, all of those things. So don't neglect, especially our elderly at home. They start becoming very nosy, they bother you, they trouble you, and we feel, oh my god, he's becoming psychotic, let's just start him on give him some Alprax, give him a Restil, and it calms them for a bit. But it's something that you have to be very, very mindful about. You won't believe me. 2 weeks ago, I operated on a doctor couple who the wife started having some kind of abnormal behavior. And I mean, in Parsis, we tend to pass that off as normal, but this one was not Parsi. And she started talking abnormally and wasn't talking to the husband properly, wasn't paying attention to the children. So naturally, the husband thought that this is, let's talk to a psychiatrist. Psychiatrist gave some medication for anxiety, etc. And 3 days after the onset of these symptoms, she had a massive hemorrhage inside the brain. And she came to us in a coma, and we had to operate as an emergency in the middle of the night, remove the blood clot. It was a arteriovenous malformation that had ruptured. And luckily she survived and she's getting better. But my suggestion is that even if you do a scan for these symptoms, remember that 90% of the time it will be normal. 99% of the time it will be normal. And we might think that, oh, this is an overkill. I mean, doctors are just out there trying to make money, just by ordering tons and tons of tests and making us do so many investigations. People are reluctant to go to the hospital in these times. So you have to speak to the right people who will be able to say, okay, maybe let's hold on. This doesn't seem like something that requires treatment urgently or something that can be treated. The other thing, that if you're having forgetfulness, if you're having symptoms of dementia, you have to do one basic panel of blood tests. Don't ignore it. Do one basic panel of blood tests, because vitamin D deficiency can cause these symptoms. Thyroid problems can cause these symptoms. Syphilis, this used to be prevalent once upon a time. Thankfully, we don't have syphilis anymore. We have other sexually transmitted diseases to worry about. But even something like a small collection of blood in the brain. Elderly people, they bump their head somewhere, they don't even realize it. Over time, blood builds up and they start forgetting. We just pass it off as being abnormal. Get a scan, get one scan done, get one basic panel of blood tests done. Then if all that is normal, then you treat with whatever you want, no problem. But don't miss out something that you can, completely reverse and completely change the quality of life. And even if that is the case in 1 in 100 people, it's worth doing these tests. But you have to go to someone who can astutely decipher what to do and when to do. Normal pressure hydrocephalus is an entity where water accumulates inside the brain, and just by draining that fluid, all these symptoms reverse. So those are the things. I mean, in a time where there's so much of information available on the internet, I think it's up to us to empower ourselves to take our own health in our hands. There is another common condition that people go to the dentist for. It's called trigeminal neuralgia. Patients have pain in the jaw. It's sharp shooting pain, and oftentimes there's an associated cavity, so the dentist will fill the cavity or then even do a root canal. But this pain doesn't go away. It's a very classical, characteristic sharp shooting pain. I've had people have 4 root canals. I've had people. Uh, I've had a patient who's had so many dental treatments because of this problem, which is actually in the brain. They were advised a jaw replacement. Can you believe that? And when all it is it's a simple vessel that's kinking on the nerve inside the brain, and that nerve supplies the area of the face and the jaw, and that is why patients have excruciating pain. And all is required to be done. Most of these patients actually get better with medication, with a certain form of medication. And if they don't get better with medication, you can give them an injection, and if that doesn't work, you can put a little pad between the artery and the nerve, and their pain goes away completely. Dramatic improvement in pain. This is real. This is not a Google photo. So I mean, we've really evolved with the way we've come a long way. This was how surgery used to be performed once upon a time. It actually used to be called an operation theater because the surgeon performed and everybody else saw him perform. And now we've really moved up the barrel fantastically, and we have a robot in the operating room. We have a navigation system. This is me operating through the magnification and illumination of a microscope. Everybody in the operating room can see what's going on, and it's a beautiful little advancement that we've made in medical science, though we have a very, very, very long way to go. The other thing that one should not miss is a stroke. Sometimes if you suddenly have someone's face drooping, or someone's holding a coffee cup and it falls down from the hand, or the speech is slurred, you don't waste time calling up somebody, waiting for your general physician to come home. None of those things. You take the patient straight to the emergency of a hospital, because time is of absolute essence. If you give a clot busting drug within 3 hours of the onset of symptoms, then all these symptoms, a stroke, a complete paralysis, can be reversed. If it doesn't happen with a clot busting drug, you can actually put a wire endovascularly, put a wire in a blood vessel and remove the clot, and patient's paralysis reverses. So that's the advantage, but time is of essence. And if in Bombay's traffic, if you wait for a physician to come home and then say, okay, let's do this, let's do that, you'll miss the boat. Instead, even if you have a sudden onset diplopia, sudden onset double vision, sudden onset, any kind of thing that's sudden onset and is not getting better in 10 to 15 minutes, you should not wait sitting at home wondering what will happen. 9 out of 10 times it may be normal. Low blood pressure can cause these symptoms. Low sugar can cause these symptoms. But you don't want to miss something that you can reverse. A lot of people talk to me about, how do I keep sharp? How do I improve the quality of my life? How do we? Once upon a time, we used to think that neurons don't generate. You're born with a fixed number of neurons, as if 100 billion is not enough. But the beauty is that they continue to form synapses in the brain, and these connections is what we must aim to foster all throughout our lives. There's no rocket science to keeping your brain sharp. You have to go less on the amount of calories that you're eating. Even if you drop by 500 calories a day, it'll make a huge difference. Go easy on all the saturated fats, all the palm oil, coconut oil, sunflower oil. Involve yourself in some kind of exercise. You have to do some kind of exercise on a daily basis. And the best and the simplest form is brisk walking for about 45 minutes. Listen to your music, go out with your partner, do any of those things. Uh, any form of, so there's one advice that I can give you to take care of your brain as well as your back. Then it's just keep moving. That's the stairs instead of the elevator. uh, I sometimes try and cycle to work. Try and do as many of these things that you can do without motorized assistance. And hike up whatever you need in your diet, get enough of sleep, all of those things. People also ask what kind of food should we eat. And if you can name and identify any of these items, then they seem to be good for you. Green leafy vegetables, all kinds of berries, blackberries, blueberries, strawberries are excellent. Fish is very good. Avoid red meats, avoid pork, avoid all of those things. Those are not very, very good. And I mean, I'm happy to see that eggs are on the list. Parsis don't need an excuse to have eggs. We have eggs on eggs. I went to a friend's house during the lockdown, and this is what this is what a Parsi fridge looks like. So I mean, there's no shortage of. We are okay with our diet. And a lot of people say, how do we get more creative? A lot of people, so this whole concept of right brain, left brain does exist in some sense, but it's actually getting the two brains to talk to the other, which is important. So start, if you really want to keep sharp, and start doing things with your non-dominant hand. Brush your teeth with your non-dominant hand. Listen to music that you've not listened to before. Indulge in conversation that you've not had on a regular basis. uh, like we do physical exercise for our outer body, all this inner work is termed as inner size. And you should do it constantly, mindfully, on a daily basis. Read something new every day, all of those things. Language, I mean, we are really fortunate to grow up, especially Indians, grow up with everybody speaking 2 to 3 languages. But even at an elder age, if you want to, if you don't know what to do in the lockdown, learn a language. You have apps, you have all sorts of things where you can do it online, and try and find a community that's learning the same language. I mean, uh, Chinese is going to be important, like we all know. Spanish is a good language. You can learn some language. I mean, if you want to go back to your roots, you can learn Farsi. Farsi is a beautiful language. It's so poetic. It's almost enigmatic. Um, so indulge in learning a new language. They say that learning a new language later on in life delays the onset of dementia by about 4 years. And then the other thing is, just let your mind be. We are all so focused on trying to want to do stuff all the time. My children come and tell me so often that I'm bored, I don't know what to do. And I think it's a great thing, because it allows for them to think, it allows for them to come up with their own stuff. We want to restrict children from playing. Don't jump here, don't jump there, don't do this. In fact, that's something that has to be encouraged. children are supposed to Children are supposed to create a nuisance. They're supposed to uh, you know when we're all adults, we actually envy that life. At some point we say, oh my gosh, I hope I was a child again. And when children are doing it, we are saying, don't do this and don't do that. Micro dosing, I mean, a small amount of alcohol is not too bad, apparently. Some people say even marijuana, etc., but I wouldn't recommend it. But um, for our community, I don't think there's anything like a small amount of alcohol. Mindfulness is another thing that one needs to really now. Spirituality has taken a big boost in the lockdown, in the pandemic. Everybody is talking about consciousness and all of those beautiful things, which is important for us to be aware of. And sitting quietly for 10 minutes a day, just focusing on your breath, I think makes a huge difference. A lot of people say, oh, I can't sit still, or I can't meditate, or I can't. I mean, there's no I can't, in my opinion. I think It's all very possible. Just 10 minutes a day, if you sit in a quiet corner, focus on your breath going inside your nose, coming out, and if you get carried away by any other thought, bring yourself back to your breath. I mean, this is what the Buddha taught 2500 ago. The West is making a multi-billion-dollar industry out of it. We have it in our own homeland, and I think we should really take the time off to do this mindfully. And actually, mindfulness is, just being present in the present moment. I mean, it's so simple as a concept, but it's so difficult to do. We always think about, oh, I wish uh, we had this, or this is what our future is going to be like. And in the bargain, we completely tend to dismiss how beautiful the present is. I mean, we should just all be happy to be alive and listening to this talk when almost every one of us knows someone personally who has died in the last 1 year. So, I mean, practicing gratitude in some sense is also a big way to take care of the space in your brain. So we are really backed by a great amount of scientific data, and I don't want to go into studies and numbers. That if you take care of your brain health and you really focus on the things that I spoke about in the first 30, 40, 50 years of your life, the next 50 years of your life, I mean, all Parsis live to close to 100, right? So the next 50 years of your life, you'll be able to really delay the onset of dementia, delay the onset of old age problems, and you won't die with any regrets. So that's just a small summary of the brain part of what I wanted to tell you about, and we'll take questions towards the end. I think we're okay as far as time is concerned. In another 15 minutes, we'll probably wind up with the back part. And spine health is also so important. Understand that the spine is an extension of your brain, right? The spinal cord is an extension of your brain. It's part of the central nervous system. And that's why neurosurgeons deal with this on a daily basis. The question that is often asked to me is, oh, I have a spine problem. Who do I go to, a spine surgeon or a neurosurgeon? You go to any physician or surgeon who's taking care of the spine on a regular basis. Don't go to a orthopedic surgeon or a spine or a orthopedic surgeon who does spine once in a while. Go to an orthopedic surgeon who does spine all the time, or go to a neurosurgeon who does a large amount of spine, which most neurosurgeons do. So again, this deciding on which doctor to go to is sometimes actually a dilemma even for doctors themselves. So I can imagine how hard it must be for a lay person to figure out where to seek treatment. I mean, the simple thing is just give me a call and I'll help you. So you have to understand that the spine is made up of a column of 33 bones. While it's just one single organ, all these bones stack up on top of one another with these few curvatures. And there are these nice discs between the spine that acts as shock absorbers. And this is where the spinal nerve roots come out at each level, and they supply your hands and legs and all of those things. And this is the intervertebral disc. This is the disc. So between these two vertebrae is a disc, and from here is where the nerve root comes out. So when this disc bulges or it degenerates or pinches, this pinches on the nerve, and patients have sciatica, patients have leg pain, back pain, all of those things. And the beauty is that 95% of these problems can be dealt with medication, physiotherapy. You don't need surgery for these things, and most people get better. So you shouldn't fear going to a doctor. What I want to focus on the next 5 minutes is actually how to take care of your spine rather than what to do when there is a problem. So all of us are sitting, everyone's working from home. We're sitting for long hours. The important thing is really not to sit for more than half an hour at a stretch. After sitting for half an hour, stand up, stretch a little bit. I'm guessing it's been half an hour since all of us have been sitting. The right thing to do is right now stand up, stretch a little bit, and then sit. Even if it's 30 seconds or 1 minute of stretching, it'll make a big difference. The muscles ease up a little bit, nothing goes into spasm, And when you're sitting, you make sure that your bum is at the right angle of the chair all the time. Don't slouch in your chair. You should not be able to put any finger between the bum and the right angle of the chair as much as you'd like to put it. So make sure that you sit upright very, very mindfully. And this whole workstation that we've established at home has to also be tailored so that the ergonomics of the body are very, very well set. Your screen should be at least at a distance of 2 feet from your eyes. It should be um, it should be at eye level. A lot of us are bending down and working on our laptops all the time, and that causes an immense amount of strain on the neck. So, and you should try and put a 6-inch platform where you sit so your hip and knees at right angle to one another. Your elbows should be nicely relaxed. And again, even in this position, make sure that you get up every half an hour. It's very important that you get up and stretch a little bit. Like I said, the one thing that you should focus on, whether it's the pandemic or not, is to keep moving. We don't really bother about nowadays. A lot of us don't wear shoes because we are all stuck at home, right? So, but the real thing, the way to tie your shoelace is not bend forward completely down and tie the shoelace. You put your foot on the opposite knee, and these are very, very small things that you need to do mindfully, that will prevent degeneration in the long term. It'll prevent your back from aging faster. It'll prevent not only your back but also your hips and your knees. How do you pick up stuff from the floor? We don't really bother. We don't really care about how to really bend down. But when you bend down, it's almost important that you bend down both at the knee and at the hip before you can really get some support of something. Don't lift anything heavy away from the body. If you lift anything away from the body, it really increases the lever force of your arm, and then you get a muscle spasm or something gets pulled. So whenever you're lifting something, make sure you bring it close to your body and lift it up. I mean, these are very, very basic things, but if something falls down, we don't really bother about doing this the right way. But if you do, you will prevent long-term problems. I love sleeping on the stomach, but I think it's not the appropriate way to sleep. The best way to sleep is either on your back or on your side. If you're sleeping on your back, you should ideally place a pillow below your knees. And if you're sleeping on your side, you should also place a pillow. Once you put a pillow between your knees, your spine gets aligned nicely. So some people say, should we use a pillow to sleep or not to sleep? I mean, I think a small pillow that contours to the shape of your neck is a good idea. Again, how do we get out of bed? We just get out, right? We don't really bother in the morning. The only thing we've been taught is to seva nashembo and get out of bed. So we do that and we get out of bed. But use your hands to get out of bed. Get on the side. Use your hands. Put your legs down first. And these things don't make a difference when you're feeling okay, when you're in your 30s, when you're in your 40s. But as you start aging, and once even getting out of bed starts to become an issue, you will realize, oh, I wish I had done this the right way 10 years ago. Probably I wouldn't have been here now. But as they say, it's never too late to start anything. It's never too late to course correct. It's never too late for any kind of implementation. Similarly, getting into a car, we just get into a car. But the technically right way to get into a car is to actually sit on the seat with both your legs and then put both your feet in simultaneously, and similarly get out the same way. I mean, people will laugh at you, but this will prevent hip problems, knee problems, back problems, all of that. And every time you get into a car or get out of a car next time, the good news is that you will think about me. So just doing some basic amount of back and core strengthening exercises, not more than 5 minutes a day. Just some basic amount of back strengthening exercises makes a huge difference. I give this back chart to all my patients. I mean, I'm happy to share it with all of you. So it's very, very important that you strengthen your core. It's very important that you strengthen your core, because understand that none of these problems actually require bed rest. some people are advised bed rest for a week, for 10 days, for 3 weeks. I've seen patients advised bed rest for 3 months and all of that. No spine condition requires bed rest for more than 1 or 2 days. There are very, very specific, only 2 or 3 conditions that require prolonged bed rest. If you have a sacral fracture, or if you have one of those things, there are very specific indications. If you have a back spasm, please don't rest it out, stretch it out, because resting it causes, even patients who we operate, spine patients who we operate, we get them out of bed immediately. Within 3 or 4 hours of surgery, they're out of bed. So bed rest uh, is not a correct solution. It's something that should be avoided at all costs, unless it's advised for a very, very specific problem. So bed rest beyond 1 or 2 days is don't take that. the the complications of lying in bed the complications of lying in bed far outnumber the complications of being out of bed. So this is an extremely important take home message. uh, I saw a lady recently in Vadiabag 2 months ago, and she was said, no, you have severe pain, just stay in bed. Any kind of movement, even in bed, used to cause excruciating pain for her. And I said, no, nothing doing. You have to get out of bed. And the first week, she just managed to get out of bed. The next week, she managed to walk to her hall. Then 1 month later, she's saying she's taking walks in the veranda. And 2 months later, she's lagaing chakkars of the colony. And she's 85. She lives alone. I mean, you can't afford to be in bed. You have to get out of bed. We are also facing and seeing a lot of people who have neck problems uh, because of working in the environment that we are working in. A lot of people have slip disc, cervical spondylosis, we call it. Uh, Tumors are very rare in the spine, but those are things that should not be missed. Tuberculosis. I mean, this whole COVID thing has shoved tuberculosis under the carpet. People are in our country, 3,000 people die of TB every single day, and nobody is talking about it. Can you imagine? We are talking about 300 people dying of COVID, but nobody is talking about the tons and tons of people who are dying from other causes. So what COVID has done in some sense is it has masked everything else. And the whole idea of this presentation is to be able to try and uh, tell you that don't neglect what you might be able to treat and reverse. So imagine, I mean, all of us are listening to and looking at WhatsApp all day long, right? I'm equally guilty of that. But we've studied this, and looking at your phone for half an hour at this angle is like putting a 30 kg weight on your head. We don't realize it at the time, but this is what is causing wear and tear of neck muscles, and eventually of bones, which then cause problems in the spinal cord. So we are seeing lots and lots of young adults who are having problems because of being on the phone, being on the screens. I mean, it's an inevitable part of our lives. It's not going to go away anywhere. It's only going to get worse. So the only way to really uh, take care is to be able to find the correct way to do it right. So if you have neck pain, that's fine. All of us have had neck pain. But if you have tenderness, if you press on the neck and it pains, or if you have any restriction of neck movement, you can't move your neck the way you used to, or if you have pain radiating to the arms, it's extremely important that you seek some help. Again, understand that 90% of these things can be managed with just the correct advice, without any requirement of surgery. But you should get help correctly so that you don't suffer unnecessarily. Since all of us are sitting at home, just some simple exercises. These are called isometric neck exercises. You push your hand against your head and count till 10, and you do the same thing. You push your back against your head and count till 10, and on either side you can push and count till 10, and you'll see that this strengthens the neck muscles. You have to understand that the bone, please listen to this, the bone is the weakest part of your body. It's the weakest part of your body. When the embryo forms, when the human baby develops, the bone is the last thing to form. It's the soft tissue, it's the skin, it's the muscle, it's the ligaments. Those are the things that form first. Those are the things that are strongest. The bones just form around it to provide some kind of scaffolding. So while we think that all our spine problems are due to bones, it's actually due to the soft tissue that's weak, that's not holding onto the bone properly, that results in ligamentous laxity, that causes the disc to degenerate, and that causes the nerves to get pinched. It's not the other way around. It's not that your disc is degenerating and then the bone is moving a little bit and then your nerve is getting pinched. So it's everything is focused on soft tissue. Yes, of course, you have to maintain your bone health. You have to drink your Bonvita. You have to do all of those things. But please understand that, even things like obesity, even you will realize that you do nothing, you just lose 1 or 2 kilos. That's it. If you have back pain or you have neck pain, you lose 1 or 2 kilos and you'll see that you have at least a 20-30% reduction in pain. So excess weight, and I'm guilty of having a lot of it myself, excess weight actually puts an immense amount of strain incorrectly on your center of gravity, and that's pulling on the bones, and that's causing problems with your back and neck. So lose some weight, do some exercise, keep moving, eat rightly. None of this is rocket science, but it makes a huge difference. Yes, you see this lady, she's about 120 kilos. She's got severe back pain, severe leg pain. She's bent forward. She can't even walk for a couple of meters without holding on to support. And she's tried everything, and she has a degenerated spine. And this is the last resort. If you have severe pain, you have a pathology on the MRI, etc. We fixed her spine with a minimally invasive operation, and she's walking like she's walking on the ramp. So surgery is required in a very, very select group of patients. And this is what we did for her, just fixed it in a minimally invasive fashion with an incision that you can't even see on the back. So, like I told you, for any spine problem, surgery is the last resort. But when we do surgery, we have to make sure that we are choosing the correct patient for surgery. We are operating on the correct indication. And we are operating on the correct side, obviously. And I mean, the surgeon matters. You've heard of people having had wrong level surgery, having been operated on the wrong side, all of those things.
Get up from the chair, lean forward.
See, this is a gentleman. Can you hear me? Can you hear me? This is a gentleman who was diagnosed to have Parkinson's disease. And from the way he was walking, he was put on medication for Parkinson's and nothing really improved. And then he came to us and we examined him thoroughly. And we found that actually his problem is not because of Parkinson's. His problem is because he has a significant compression in his spine. And we operated on his spine, and you can see 2 months later, he's walking as if there was nothing wrong with him. So diagnosing the correct problem, not letting it be, not just saying that, oh, everything is related to old age and everything is related to COVID. That's not the right way to move forward. So bone health is also very important, and you have to have optimized calcium and vitamin D3 levels, because those are not only important for bone, but those are important for muscles as well. So if you have low calcium and vitamin D3 levels or low vitamin D3 levels, then all of you should take a course of vitamin D3, because for some reason it's not adequately supplemented in our diet, for at least 3 months every year, once a week. And everybody prescribes this nowadays. So take it, because we don't, so for some reason, we're not getting enough sun. We're not being able to get the amount of vitamin D that we need. And that's also attributing to a lot of aches and pains. So make sure your vitamin D levels are optimized to close to 50. That's in some sense ideal. So I'm going to end here, and I'm going to, what I really like doing is helping a lot of lay people understand problems of the brain and the spine. And the way I do it is through storytelling. I write in the Jame and the Midday, and I really enjoy sharing these stories of real. These are real life stories of real people with real problems, and it's just my way of trying and bringing some awareness to our community and our society of what these problems entail, and how we don't have an answer to all of them. We don't have a solution to many of them. Sometimes there's very little that we can do, but the one thing that we can do is really try, because sometimes when we try, it really does make a difference. And life is meaningful because it's a story, and in stories, endings matter. And more often than not, we are able to provide happy endings. No pun intended. So I'm happy to take questions if there are. I think I can take a look at the chat box. Was I audible throughout?
Yes, Dr. Mazda, thank you very much. You were audible throughout. We do have quite a few questions. While you are going through the chat box to go through the questions, we would really request if you could just put on that slide of the back exercises, the cervical exercises, so people could take a screenshot of that, please. And then we'll start with the questions.
Just the neck ones or the back ones?
The neck as well as the back. I think the back ones was what most people were asking for.
Okay, so what I'm going to do is I'll WhatsApp it to you as well.
Okay.
Because this is just a shot of the. This is just a.
Right. This one. Yeah.
This is just a shot of, half of. It's a screenshot of half the page.
Okay.
The remaining half of the page, I didn't put it. I just wanted to show it as a representation, but I will send it to you on WhatsApp, and then you can forward it to.
Sure, Doctor. Sure. We'll put it.
Whoever is interested, and I'll move to the neck one also. I mean, if you Google isometric neck exercises, isometric neck exercises, you'll be able to see several videos of them. And if you, all these exercises are, I have a website called mazdaturel.com. And
get up from the chair, lean.
On that website, there's a section called as patient info. And in the patient info section, we have all these exercises, all these postures that I showed you. All of that is available to see.
Great. Yes, Doctor, one more question that had come to us is from our full-time morbids, because they have to constantly read and pray, or they get this stiff neck problem. So would these exercises help, or they need to consult, physiotherapist or something?
No, I think these exercises help for sure. These exercises will help. I understand that, morbids sometimes don't have an option but to stay in one position and pray in one position for very long.
Yes.
So one of the advices is to be able to stretch before they get into their position. If they can do some kind of stretching of the back, of the legs, etc., before they're getting and sitting cross-legged for very long,
True.
then it'll really help them. But
Okay.
I mean, these exercises, what they do is basically strengthen the core, they strengthen the muscles, they strengthen all of that, and that's the key to getting better in terms
Okay.
of your spine health.
A tip for all our Parsi priests is to get fit and stretch, right? Get more into physical fitness.
Yes,
Bataye jaake exercise karwani chahiye.
our team of empowering mobeds is doing a great job with
Yes.
taking care of our, getting our priests to showcase what they are doing to the world, and it's a contribution that's unmatched.
Excellent. Yes, we just had them for our Friday forums this Friday. And yes, it was started by Geoparcy and now it's grown excellently. Yes, very nice. Yes, doctor, you could just go through the other questions.
Okay, I'm going to go through it from the start.
Yes.
Wow, one sec. I'm going to skip everyone that said it was a great talk and thank you very much for it. I really appreciate all of those. But I'm going to also skip the ones that said great sense of humor. Thank you very much. What is neurocancer and any disease from Please Make Me Understand? Marisban Zaiwala is asking that question. Basically, neurocancer is any cancer or any brain tumor that arises from the nervous system. So the thing about brain tumors is that 50% of them are benign and 50% of them are malignant. Benign means a tumor that just comes from any of the structures of the brain and you can excise it, and in most people that's a cure. Malignant brain tumors are of two types. Those that arise primarily from the brain, we call them gliomas, and the others that metastasize from various parts of the body to the brain, which are actually very common. So lung, liver, kidney, if you have a cancer of those and you get a spot in the brain, that's called as metastasis. So those are called metastasizing brain tumors from other parts of the body. And neuro-oncology is one of our areas of expertise where we actually master in resection of brain tumors. I hope that answers your question. When you mentioned do a scan, which scan do you mean, a CT or an MRI? That's a great question, Janine. Uh, so specific things require specific scans. If you have a sudden onset headache, you want to do a CT scan first to make sure there's no bleed. That's what CT scans grossly pick up bleeds, etc. If you have a chronic problem, ideally you should do an MRI. If you're suspecting a stroke, it depends on what your hospital protocol is. If you go to the emergency, some hospitals have a CT scan protocol, some hospitals have an MRI protocol. So let them figure out. But it's either one of the two, a CT or an MRI. It really depends on what pathology you are suspecting. Pearl's asking if a lady is consistently unable to conceive, do you suggest a brain scan? If she's unable to conceive and she has tried whatever hormonal medication is supposed to be tried, not able to still conceive, yes, please do a scan. Like I mentioned to you, I've seen 3 patients in my life. I'm sure several other surgeons have seen many who've conceived after removal of their pituitary tumors.
Thank you.
Anarwal wants to know if one gets a headache in the sunlight for a longer time, what's it caused by? I mean, don't get out into the sun. That's a simple solution. But yeah, a lot of people are very sensitive to sunlight. So the real trick would be to hydrate yourself very well, because these are all vasogenic headaches. These are all headaches that are caused by constriction and dilatation of your blood vessels. And blood vessels are pain generating structures. So those get altered. So hydrate yourself adequately, wear a nice pea cap, wear some sunglasses. I think you should be fine. How does a layperson go from a scan of some sort? How does a layperson go for a scan of some sort? Yeah, it has to be suggested by the doctor you visit. That's correct. It has to be suggested by the doctor you visit. They will be able to tell you what exactly is required, and even family physicians do a great job of identifying the problem and suggesting the scan. Someone's mentioned some medication for migraine. Yes, sumatriptan is a medication for migraine, but that's the medication you must use only in for attacks. You can't use it as a long-term thing. For long-term, we use something called as beta blockers and uh, triptomer or amitriptyline is the generic name. but sumatriptan can't be used and should not be used on a regular basis for the long run. Marizman's asking what role to play with dementia person as a neurosurgeon. Actually, that's very interesting. In fact, last week itself, I'd written a column uh, in the newspaper about so dementia can have a surgical association or a medical association. So first you do blood tests and rule out vitamin B12 deficiency, thyroid problems, all other things. And then you get a scan or an MRI of the brain done to make sure there's no, sometimes, especially in the older people, they can have a collection of blood in the head. It's called as a subdural hematoma or a subdural clot. And that doesn't present dramatically. It just presents over time. You become a little forgetfulness, you become a little old, your walking gets a little problematic. You may slur in your speech, any of those things, and you might pass it off as Alzheimer's. But that's the role of a neurosurgeon, to pick up something called as a subdural hematoma, to pick up any kind of brain tumor that may be causing symptoms of forgetfulness, or any vascular malformation as well, or to pick up collection of water in the head. We term that as normal pressure hydrocephalus. It's a combination that presents with forgetfulness, urinary problems, and gait problems. And that is almost what every elderly person has, right? Most elderly people want to pass urine quickly. They tend to forget. They're a little shaky in their legs. So we tend to label that as old age. But some of these things can be reversed if you find out what the problem is. So don't just label everything as old age. How is yoga? Yoga every day is excellent. I think it's a great way to live your life. Yoga is not only physical yoga. If you actually transcend to the Sanskrit version of yoga, it's beyond physical. So, but I'm guessing you're talking about yoga in terms of asanas and postures, and I think done correctly, very, very helpful. Natalia Mystery says, I'm paralyzed on the left side. My finger is not working. I'm sorry to hear of your problems, but I don't know how to answer that question, because there doesn't seem to be a question in that. If you can give me some more details, I'll be able to help you out. But I mean, keep the physio going. It's going to help a lot. But I'm hoping you've investigated all of that and your treatment's done. Do you feel mindfulness helps after formation of tumor? Yes. So mindfulness is a way of living. It's not a it's a practice. It's like, it's as simple as doing something daily as brushing your teeth. So yes, it will help you deal with any kind of problem, where it's just anxiety, stress, or it's a structural physical problem like a brain tumor. I've known of people who've gotten rid of their cancers, and I'm a man of science, and I'm open to accepting that these alternative ways of living can actually help people get rid of their malignancies, can help get people get rid of cancer, can help. It's, I mean, I don't know the science behind it. Science has not been able to prove how this happens, but I know of people personally who've who've done this. So looking inside and trying and sorting out your problems does help. What's the difference between a chiropractor and a neurosurgeon? I mean, it's good that I don't have a big ego. Otherwise, I would have been terribly offended. but but a neurosurgeon is someone who operates on the brain and the spine, or someone who treats conditions of the brain and the spine that probably require a surgical intervention. A chiropractor or a physiotherapist, in some sense, in an extended way, tries to fix most of these problems by physical manipulation, by exercise, by they can do, let's put it that way, they can do everything a neurosurgeon can except for operate. So actually, there's not much of a difference. And understand that surgery is only 10% of what we do. A lot of people feel that, oh, you go to a surgeon for a back problem, and the first thing he's going to say is you need surgery. But that's not true. That's just a perception that people have about us, albeit incorrectly. Uh, okay, I think someone's already answered Pearl's question. A chiropractor is not a medical physician and does not do surgery. I thank again everybody for. Preeti wants to know, I'm the caregiver of my mom who has both Alzheimer's and Parkinson's, and I've been the degeneration. At age 86, it's not possible to make the treatment aggressive. But what is the best way to handle periodic, inexplicable crying? Yes, that's a good question. And to be honest, I'm not the best person to answer this uh, because I'm not directly involved in the care of neurological patients who have Alzheimer's and Parkinson's. But I guess that these are part. This is called as pathological crying, or some people even have pathological laughter. And the only thing one can do is to allow it to pass. There's no real medication for that. Sometimes these symptoms can be because of structural problems in the brain. And while in your case, 99%, I'm guessing the MRI of the brain would have been done and it's just shows degeneration and nothing else. Um, it might be worthwhile speaking to people who are experts in this field. But if you send me a WhatsApp message, I'm going to try and find out what's the best way to address this for you. I'm also going to read out the questions that have been directly asked to me without um, it showing up on the main box. Is back pain similar to spine issues? More or less, yeah, you can label it as spine issues. Kumi, thanks for that comment. Though mindfulness is vital for our well-being, neuroscience now tells us that introspection, unless used correctly, can only result in chatter. That's absolutely true. You won't believe it that I just finished reading the book 2 weeks ago, and I realized that 90% of what I'm doing is chatter. And he's given a beautiful and I've also I also wrote an article that's going to show up in the midday a couple of weeks later about the surgical chatter and what the kind of conversations that surgeons have with themselves when things go wrong, and how majority of them are absolutely useless. So I agree, introspection has to be done in a very systematic manner, and not everything that yourself tells you about yourself is probably true. And one of the ways to introspect is to distance yourself from the problem at hand. Use the fly on the wall approach, and probably say, think of what you would do if you were giving advice to someone in a similar situation. So you're right. I mean, it's a fantastic book. Please share the slide of back exercises that's been done. Bed rest suggested during complicated pregnancy. Yes, please take it by all means. Bed rest, I'm not interfering with anyone's pregnancy. Bed rest for back issues is not advised, but if you have to take bed rest for pregnancy, please take it. However, when you're in bed, it's extremely important that you do exercises that strengthen your leg muscles. Keep flapping your ankles, bending your knees, constricting your quadriceps and your hamstrings, and all of those things. If your gynac says it's okay to do so, please don't blame any baby problems on me, okay? Uh, please share cervical. Oh, that's been done. Mazda, I teach a therapeutic art form of mindful drawing and doodling. And while doing the theory part, it mentions how the brain can benefit and you feel very relaxed, meditative, and calm with it. I was not able to understand this scientifically. I mean, uh, there are a lot of things that we are not able to describe scientifically yet. But like what has happened with the practice of mindfulness or a meditation practice, people have studied functional MRIs of the brain of patients, and they have found that these techniques help by increasing synaptic connections, by reducing the levels of neurotransmitters that are responsible for stress, all of those things. So I'm guessing it's a chemical thing that probably is at play. Roxanne's message saying, "Thank you. It was worth staying up until 2 a.m. in Canada." Well, I'm really touched. Thanks a lot. I would not stay awake to hear myself talk at 2 a.m., but thank you very much. I really appreciate it. I was in Canada for an entire year in Toronto in 2015 and 16, and then I was in Chicago for another year, and I had the best time there and met some lovely people who I'm still very much in touch with. A request: can we get this presentation? I would like to show it to my mother. Of course, yes. I will send it to the GeoParsi people and they will get it to you, or you can directly email it to me and I will
Yes.
mail it across.
Just a minute, Dr. Turel, I'll just pitch in. We also will be having this entire recording on our Parzor Foundation's YouTube channel. So you can watch it anytime too. The entire session will be there on YouTube.
Sam wants to know, is there a way to do things for weight loss or obesity surgically? Of course, bariatric surgery is a big field. And if nothing's working by non surgical methods, surgery seems to help the correct people who may benefit from it. So it's best to see a bariatric surgeon. If you need to get in touch with one, let me know. I have a couple of friends who do these things. Someone wants to know, is it advisable to lie down if possible to minimize weight on the spine while on the phone? Yeah, that's a good option. As long as you're not stressing the muscles in a different direction. So just keep focused on strengthening your muscles. Then you can do a lot of masti with your spine. You can be in postures that you would ideally not be in, but just strengthen the muscles of your spine, and that's the key. That really is the key to. Yasmin wants to know, tingling in fingers and mild numbness early morning. Yes, uh, I mean, those are signs of nerve irritation. So sometimes if we've slept wrongly on a hand, the judgny that we get, that's not really bothersome. It's just that the nerve is a little irritated. But if it's constantly happening in both your fingers, then you need to check if you have diabetes, because diabetic neuropathy can cause this, vitamin B12 deficiency can cause this, thyroid problems can cause this. You need to be examined to make sure you don't have any compression in your neck from either a disc or some bones or some ligament thickening that can also cause these things. So you should see the opinion of someone who would evaluate you. Most of these things are not really bothersome or not significant. But if you have undiagnosed diabetes, you don't have diabetes, you don't know about it, you only have this tingling, it might be a symptom of diabetes. And it's imperative that you get your diabetes under control, because that can lead to a host of other problems. Is it, Vazish wants to know, is it necessary? Oh, I'm guessing it's his dad. Is it necessary to take a higher dose of paracetamol when Crocin 500 was good enough? No, it's not necessary. These are all pharma games. The pharmaceutical industry, unfortunately, drives very strongly what we prescribe and how we prescribe. Crocin 500 is just as good. And I mean, this whole, you'll see this whole COVID scene. Right now, people are dying for remdesivir. 6 months later, they'll tell you that remdesivir doesn't work. So I don't know. We really don't know much about a lot of things. We claim to know. We are arrogant enough to say that, oh, this is what we know. But what we know is probably just the tip of the iceberg. I think what we know is the tip of the tip of the iceberg. What can be advised to patients with ankylosing spondylosis? So there's no term called as ankylosing spondylosis. It's ankylosing spondylitis, which is a different entity completely. Spondylosis is just when you have degeneration of the spine, you call it spondylosis. But ankylosing spondylitis is inflammation of the spine, and patients have a stiff neck, and it's called as a bamboo spine. All of those things, and it depends on the stage of the condition. Mostly, these patients just do well with anti-inflammatory medication, but some of them may require biologics or immunotherapeutic drugs. And a rheumatologist is the best person to answer these questions. So you have to be careful of what you're talking about. Is it ankylosing spondylosis or spondylitis? Um, Someone wants a slide of the headache types. That was just a joke slide. It's just a pictorial representation of what headaches would. It's not scientific. At least that you should be able to tell. Radiation from mobile phones, transmission towers, Wi-Fi, Bluetooth can lead to brain damage. That's a question. Yes, it's possible that it can. There is some data to suggest that it does. There is other data to suggest that it doesn't. We won't really know, to be honest. I don't have a correct answer. You're not going to stop using any of these things, even if I tell you that it's going to cause brain damage. There are physios specializing in body alignment. Is that helpful? I'm sure it would be. Uh, as long as you go to the right person. There are a lot of spine clinics also in the city. They do some kind of analysis, etc., of the spine, and then they tell you a digital spine analysis, and they tell you what muscles are weak and how do you strengthen them. So if you go to the right people, it's helpful. See, a lot of it. Remember one thing: a lot of this care can be done personally by yourself. You don't require. You may require some guidance, but you really don't require a lot of fancy tools and fancy things to go to. Apurva is asking, I'm the caregiver for my mother who has possible autoimmune encephalitis detected early and she's getting better with IVIG. Is it possible for such patients to recover completely? Yes, absolutely. Autoimmune encephalitis is a neurological problem that is an inflammation of the brain because of an autoimmune issue, and patients can recover completely. It requires holistic care. So, like you rightly say, would a motivational counselor help revive her mental health? Absolutely. Some kind of all of these things help. You don't know uh, how they help. And if you could please share some leads. I'm sure the GeoParsi people have uh, leads to motivational counselors, but I can help you with them definitely. You just send me a WhatsApp on the message on my number, and I'll definitely reach out to you. What's your WhatsApp number? I think someone's put it up already, but Pearl, you can put it up again if always great to see you. Which book did you refer to about the introspection book? It's a book called Chatter. It's written by a neuropsychologist called Ethan Cross. Um, it's called Chatter: The Voice in Our Head and How to Harness It. It's a beautiful book. I mean, it's weekend reading. It's really nice. You I've written an article on that which will come out a couple of weeks later, so it'll give you some more insight. Does age make the brain shrink? Oh, yes, everything shrinks with age. Again, no pun intended. But as you grow old, you tend to atrophy. Even your height tends to become a little less. Your spine becomes a little bent. So all of these things uh, do do atrophy. But even if it cannot be reversed, and we have enough data to say that sometimes it can be reversed, you can delay it significantly by dealing correctly with your brain and spine. Is frequent vertigo a neuro problem? So frequent vertigo can be a neuro problem, or it can be a middle ear, inner ear problem, or it can be a heart issue also. You need to make sure, or it could be related to the medications that you're taking. So you need to make sure that you've ruled out all of these before just popping Votin left, right, and center, which is what most people do. Cyrus Engineer wants to know, would Bell's palsy require surgical intervention if it repeats again and again? Bell's palsy usually doesn't repeat again and again. Again, Bell's palsy is an inflammation of the facial nerve, and most often it doesn't require a surgical intervention unless the nerve has caused complete paralysis of the face and you want to reanimate the face. You might want to do a nerve transfer. But Bell's palsy per se doesn't require a surgical intervention. It gets better on its own. But in those cases that it doesn't get better, you might require a surgical evaluation. Daljit is saying, I have a disc herniation at L4-5. The neurosurgeon has suggested immediate surgery. The orthopedic suggestion has suggested not to go for surgery because this is an old issue and surgery will be complicated, and put me on medication and physiotherapy. When I visited physio, she ruled out muscle strengthening and just focus on decompressing the nerve. Which line of treatment should I go for? So, I mean, it's very hard to give an opinion just based on this description. But if you're getting better with the physio, with whatever she's doing of decompressing the nerve, then you try the physio. If with the physio you're not getting better, now since you've already been to an orthopedic surgeon and a neurosurgeon, all you need to do is come and take a look at me and we will solve your problem. But on a lighter note, do what works for you. Sometimes the physio can aggravate the pain. Don't do any physiotherapy that aggravates pain. So if you're feeling better with medication and physio, then continue it, unless you have a neurological deficit, such as you have weakness in your leg or any of those things, which may require surgery earlier than later. My husband and me met with a car accident on 13th April. So it's close to a month. And a battery of tests were done and no brain damage was found. Would you suggest we must visit a physician? If you are absolutely all right now and you don't have any issues, nothing to do. Sometimes you may have a little bit of headaches and a little bit of forgetfulness, and those are all effects of a probable concussion, but those will also settle down. What's the difference between a CT scan and an MRI? There are different modalities of imaging the brain. The CT scan uses radiation to image the brain. The MRI uses magnetic waves to image the brain. The CT scan gives you more information about bone and blood and fat, whereas an MRI gives you more information about the brain parenchyma and the soft tissue and all of those things. So depending on what problem you're trying to rule out, a CT scan is cheaper than an MRI. A CT scan is more readily available than an MRI, but now in our city, you have MRIs available like Starbucks. Someone wants a lecture on tongue neuralgia. Okay, we'll do that if Geo Parsi wants me to talk again. When I get up in the morning, I find stiffness in my body. Anything I can do? Yes. One thing you can do is stretch before you get out of bed. So take your knee one at a time and hold it and push it into your chest and count till 10, and do it with the second knee and count till 10. And that way you'll feel a little better, and stretch a little bit and you should be fine. Causes of neuralgic pain over the tongue. So again, like you have trigeminal neuralgia, which compresses the trigeminal nerve, and you have face pain. if there's some compression of the nerve that's supplying the tongue, which is the hypoglossal nerve, and it's called hypoglossal neuralgia, then uh, you may have to do something to deal with that. But that needs to be evaluated a little bit in detail, and we can talk about it if you're willing. Scientists say we use only 2% of our brain. What does that exactly mean? See, I mean, that number, some people, I've heard this number range from 2 to 20. It means that we still have an immense amount of possibility in our brain to harness the potential, the full potential of the brain. And we somehow don't tend to do that. We can access higher realms, we can get more insight, we can become more intuitive, we can do all of those things, we can remember more, we can. So you need the tools to be able to expand using your brain to its maximum potential. I think that's what most scientists mean. Someone wants to know, can you please throw some light on acidity, stomach ailment related to headaches, and what's the best way to get relief? I think, see, a lot of these problems, in my opinion, and I may be wrong, have an emotional or a psychosomatic underlying pathology. So if you look at Louise Hay's or Jerome Open's books, they will give you certain emotional causes of acidity, and because these are all, this is not how the normal of the how the human body is supposed to function. uh, there has to be an underlying attributable emotional stressor, and if you're able to identify that stressor, you'll be able to overcome it without having to pop a lot of pills for most of these problems. But Altaf, we can talk about it um, on radio. Altaf is the host of All India Radio who's asked this question. When a patient falls and hurts 7 vertebrae, and then with trauma surgery, a plate is put, will he be normal? He's in the US. So it depends on, if he does not have a neurological deficit, if his leg is not paralyzed at the time of the injury, all of that, then there's a high chance that he'll be fine. But if there has been a significant impact to the nerve, or a nerve has been damaged from the impact of the trauma, it just depends on the extent of injury, whether it's an incomplete injury or a complete injury. If it's incomplete, you still have a chance of recovery. If it's complete, then the chance of recovery is quite less. Infertility, brain tumors, and obesity. How significant is the relationship? Uh, it's a very spiritual question. I don't think one can, I mean, they're very tangential. Some brain tumors can be the cause of infertility. Some brain tumors can be the cause of obesity also. So certain brain tumors called as craniopharyngiomas, they arise from the pituitary gland, and they occur mostly in, commonly in children, not mostly. And the commonest symptom is hyperphagia, that children just tend to eat and eat and eat. And and they have hormonal problems as well. So some of these tumors, craniopharyngiomas, are tumors that can cause both infertility and obesity, and it can happen in women as well, since someone's talking about Mother's Day. Thank you. Mm, I don't have diabetes, but a slip disc from the last 14 years, but always cramps, tingling, taking medication. I'm 66 years old, but now not able to. Can you suggest something? I also got arthritis. So these are things that actually need to be examined, because it requires a holistic view of something. So we are happy to see. We are happy to see you if that is the requirement. But basically, it will have to, if something's not working, then we'll have to evaluate the spine. We'll have to study what exactly is causing your problems. Is it coming from diabetes or is it coming from something else? Which view of the scan should be taken for a headache which is so severe that even the eyes can't open? The headache is always up in the night and severe enough to wake you up. You should get an MRI of the brain done. That's it's straightforward. You should just get an MRI of the brain and make sure there's nothing going on inside, because these are not symptoms that you should ignore. And if the MRI is normal, then you can be rest assured that you're dealing with something less sinister, and we can take care of it. Rupa says, I used to hike, but since a decade or so, I find myself suffering from the fear of heights and I can't hike. Could there be a neurological problem? No, the fear of anything is never neurological. Fear is an emotion. It doesn't stem from a structural substrate. So you can overcome it. It's not a big deal. Maybe we'll go for a hike together. And are you if you're in Bombay, then we should do a hike together. I love hiking. I mean, getting into the outdoors is the best thing you can do for yourself. So this is a fear that can easily be overcome. It's not a big deal. Questions will keep coming. Let me know when you want to wind up. Oh,
Yes,
no, I'm happy.
it's 12 noon, doctor, and many personal questions I'm sure people can WhatsApp.
No, I'm happy to answer them if they need to be answered here. It's nice to have, I mean, no one's doing anything on Sunday anyways, right? Okay. What are you going to do after this? Watch some boring stuff on Netflix. Someone saying that I have already seen her and there's an L4-5 compression, but very mild, which is causing pain in the hip ball and socket. Physiotherapist advised ice packs because, yeah, let's take a look at you again and see what it is. If it's a hip joint problem, it has to be dealt separately from if it's a spine problem. How do we manage migraines? Do migraine medications cause long-term issues? Any medication, mom just asked for someone to get some water. No? Any medication in the long term can cause issues, but one sec, I think I've skipped. Yeah, okay. So migraine requires a two-pronged approach. One is you should have prophylactic medication. So you should take medication even if you don't have headaches, and either combination of propranolol or amitriptyline, or propranolol or amitriptyline alone. And then you should take something that aborts an attack when it comes immediately. So there's some medication that's available to reduce a attack that comes instantly. So and that needs to be continued for at least a month or two. Doesn't make a big difference, but then you need to figure out what is exactly causing it. You can alter the medications, etc. Working till late night but still having decent sleep does not affect the brain in the long term. No, if you have a good night's sleep, it's okay if you're working late in the night, as long as you feel restful at the end of your sleep. There's no, people ask me sometimes, what is the correct amount of sleep? There's no correct number to the amount of sleep that's required. Most people do okay with 6 to 7 hours of sleep. When you get a little older, even 5 to 6 hours of sleep is okay. Children need 10 to 12 hours of sleep. Again, varies from age to age. So if you feel refreshed at the end of your sleep, I don't think working late makes a difference. It's just your circadian rhythm. I face a headache only on the left side of my head. What does it mean? Again, it depends on whether it's consistent, whether it's just transient. If it's just been there for a few days, it's okay. But if it's a constant thing, a hemicranial headache or headache only on one side of the head is commonly seen in migraine. Nonetheless, I would not I would not rule out getting a scan done, an MRI of the brain, to make sure there's nothing inside. I know a lot of people might think that this is an overkill, but I have burnt my fingers on several occasions by telling people, listen, don't worry, everything's okay. And 2 weeks later, they come back when someone else has asked for a scan. So it's not a good idea to neglect anything. And scan is nothing. I mean, it costs 5,000-6,000 rupees. It's like going for dinner to some place. Rather watch your health than your belly. Um, can an AVM be detected before rupture? Yes. So an AVM, or an arteriovenous malformations, has multiple modes of presentation. So they usually present sometimes just with headaches, because the circulation and the dynamics of the brain a little is a little altered. So they present only with headaches, and sometimes they can present with a seizure. It irritates the cortex of the brain and it causes a seizure. So those are the common modes of presentations of arteriovenous malformations of the brain. And so if they, more often than not, they don't present with a rupture. In fact, recently, surprisingly, we've seen a couple of patients who've presented directly with a rupture, but the story uh, in most cases is that they present either with headaches or with seizures. In scoliosis and transitional vertebrae in teenage girls, when is surgery required? So surgery is required in scoliosis when the curve is the angle of the curve is quite high, and when bracing doesn't help, when the deformity is progressive, or when there's a severe cosmetic deformity or any kind of neurological dysfunction. Any of those things result in scoliosis. Roshan Nariman wants to know, tingling in the head occasionally for teenagers, is that normal? That's their excuse for not wanting to study. My daughter is on anti-epileptic medication, but when it was discontinued, the tingling in the brain started. It was occasional. You can let it be. It's not a bother. Just make sure her B12 levels are okay, her D3 levels are okay. All these vague symptoms of pain, tingling, numbness, etc. A lot of this is just due to deficiencies in basic minerals and vitamins, and can be supplemented easily. My mom has giddiness and she has to be only in a lying down position to get relief. Yeah, can you guide us what we should do? Whatever doctors have consulted have said it's age related. Her age is 86. So there are certain conditions of giddiness that, there's an entity called benign positional vertigo, which the giddiness comes only when you lie down or only when you change position. And there are certain maneuvers that one can do of the head to resort that, because if it's an inner ear problem, then the giddiness is caused by some debris inside the fluid of the inner ear, and that has to be repositioned. So we can definitely try and help you. I can't guarantee that we'll be able to help you, but we can try. We don't say nothing can be done unless we've given it our best shot. What's a good way to handle syncopes? So syncopes are fainting episodes. A transient fainting episode can be because of a heart problem. If you have an arrhythmia in the heart, then that has to be addressed. Or they can be a manifestation of a seizure, so that has to be addressed. If it's postural, means supposing you have a faint when you get up from a sitting position, then that needs to be addressed. You need to check your BP medication. Some people who are taking medication for prostate, it's called an alpha blocker. It causes vasodilatation of the blood vessels, so your blood pressure drops and you can have a syncopal attack. So there are many causes of syncopal attack. It could be the brain, it could be the heart, or it could be medication that you're taking. So that needs to be evaluated. What can I do when my head is paining a lot every day? If your head is paining a lot every day, then my suggestion is that you get a scan done first. If the scan is normal, then you take some medication, most probably a muscle relaxant, etc. And if it's migraine, then you need to be treated for migraine. But these are some things, these questions, I mean, some of them I would like to answer in more detail, but they're a little vague for me to really give you an opinion that you might be satisfied with. My muscles and soft tissues and spongy on right leg, hip, shoulder, and hand after a road accident. Should I continue with physio? Yeah, I think you should continue exercising them. The more you exercise, the better it will be. How to detect, my God, why are so many questions suddenly coming on AVMs? It's such a rare entity. I just gave it as an example of what can happen. How to detect an asymptomatic arteriovenous malformation? Yes, there's a family history of hemorrhage is a good this thing, but the only way to do it is with an MRI scan of the brain. I used to do a 10-kilometer marathon runs. After surgery, I fear to run. I only walk. Am I right? It depends on what surgery if you've had, and surgery doesn't allow you to run. It's a different story. But if it's only because of fear, then I think that's something you should be able to overcome and do it. Can headaches be caused due to high blood pressure? Yes, headaches can be caused due to high blood pressure. Very common cause of headache is high blood pressure or even low blood pressure. So that has to be optimized very, very carefully before you decide to embark on any other treatment. Could there be other neuro cases for balance issue if positional vertigo has been ruled out in a 36-year-old? Yes, you need to do a scan of the head to make sure nothing's compressing your internal structures that are responsible for balance. And if that is okay, then we may have to rule out other causes. And if you can't find anything, then you might have to try and see some alternative forms of medicine to help with that. I don't see any other questions after that. Is that correct, or I'm missing something?
Just one more question that had come privately was milk causes leaching of calcium. So in our diet, we should avoid milk or add. But I mean, especially with children. Yeah.
I mean, I'm not a nutritional expert,
Sure.
but I know a lot of people are going vegan now, and that's the latest thing. And a lot of milk is bad, but generations grew up on having milk, and we've all done okay, I think. So I don't know. There's a philosophical aspect to it. There's a scientific aspect to it. I mean, I would drink it. Anything in some form of moderation is okay.
Great. Thank you, Dr. Turel. It was really very informative and interesting. Thank you for answering so many questions. And I'm sure all our viewers will take back tips that will help them to maintain good physical as well as mental health. Your tips on mindfulness were really inspiring. Thank you so much. And just taking on from that is our next event that is lined up is a Friday forum on the 14th of May. Shamak Dawar will be there in conversation with Marzi. And there's a slight change in time. Most of our Friday forums are from 6 p.m. to 7 p.m. But this session, please note, will be from 7 p.m. to 8 p.m. Thank you, viewers, for all logging in. I'm sure you guys really had a great time, especially with Dr. Turel's sense of humor. It always inspires and makes our day nice. And for more information about Geoparcy, our website is geoparcy.org. Or you could write to us, even if you have questions for Dr. Mazda, at geoparcy151@gmail.com. Mazda Turel's website again is www.mazdaturel.com. Am I right, Doctor?
That's right.
Yes. So you'll get quite a few tips, exercises, or anything else that you want. You could just log in over there. And just as I started the session with, talking a little about Geoparcy and all the 313 babies that we've added to the community, Doctor, I'm sure we are working very hard and we will 100% add many more. At least 100 babies a year, as you said, is a very good target. But we need, viewers, all your support because this is a very sensitive topic. We can't knock on doors and tell Parsi couples, come on, have more children. So we need your support. Please do just pass on our message, marry early, have more kids. We, on an average, Dr. Turel has 2, I have 3, and from my experience, we can tell it's not such a tough thing with all our corporate jobs and surgeries and everything. Parenting is tough, yes, but it's not so difficult that we stop at once. So at least for the community, we encourage our couples, please, hum do hamare do or hum do hamare teen is something that the Parsi community desperately needs all of us to do it. So please do pass on our GeoParsi message. Tell more people to just get the right information, because many people just know it's either IVF or fertility. Some people think, confidential, kharab lag se, how can we go? But believe me, it's 100% confidential. There's a lot of things that we do along with the financial support. We also provide free counseling to the couples who are facing infertility. So please do get in touch with us, and hopefully we will add many more. Of course, the pandemic has been really stressful, taken away quite a few of people's lives, and we are very sorry for that. Very, sometimes it does get depressing, but we look forward to the silver lining on all the dark clouds and for good times to come back. All of you, please stay home, stay safe, stay sane and healthy. Thank you so much. Catch you all on Friday at 7 p.m. Thank you, Dr. Turel, once again. God bless. Thank you for sparing your time.
If you need any help with the reviews,
Thank you, Doctor.
Bye.